Parkinson's disease and early signs that are easy to miss. Did you know that Parkinson's disease does not always begin with obvious shaking? In the early stage, the condition may appear very quietly. A hand may shake slightly while at rest. Walking may become slower. The body may feel stiffer. Handwriting may become smaller, or the voice may become softer than before. These changes are often mistaken for aging, tiredness, or common body aches. In today's video, Mo Healthy will help you understand what Parkinson's disease is, what factors may be related to it, and the early signs you should not ignore. Before we begin, please note, this video is for informational purposes only and does not replace medical diagnosis or advice from a doctor. If you or someone you know has unusual symptoms that last for a long time, please see a neurologist for proper evaluation. What causes Parkinson's disease? At this time, medical science has not identified one single cause of Parkinson's disease. Most cases are believed to be related to a combination of factors, such as age, genetics, environment, and gradual changes in the nervous system over time. The risk of Parkinson's disease usually increases with age. Some people may have genetic factors or a family history, but this does not mean that everyone with a family member who has Parkinson's will definitely develop the condition. Long-term exposure to certain chemicals, pesticides, solvents, or pollution may also increase the risk in some people. In short, Parkinson's disease is not caused by one simple reason. The important thing is to understand the condition correctly and recognize unusual changes in the body early. What causes Parkinson's disease? At this time, medical science has not identified one single cause of Parkinson's disease. Most cases are believed to be related to a combination of factors, such as age, genetics, environment, and gradual changes in the nervous system over time. The risk of Parkinson's disease usually increases with age. Some people may have genetic factors or a family history, but this does not mean that everyone with a family member who has Parkinson's will definitely develop the condition. Long-term exposure to certain chemicals, pesticides, solvents, or pollution may also increase the risk in some people. In short, Parkinson's disease is not caused by one simple reason. The important thing is to understand the condition correctly and recognize unusual changes in the body early. One of the most commonly mentioned signs is a mild tremor at rest. In the early stage, the tremor may be very mild and usually appears on one side of the body. A finger, hand, foot, or chin may shake slightly while the person is resting. The tremor is often more noticeable when the hand is not being used, and it may become less noticeable when the person moves intentionally. However, having a tremor does not always mean Parkinson's disease. Tremors can also be related to stress, too much caffeine, medication side effects, or many other causes. If the tremor lasts for a long time, becomes more noticeable, or appears together with other signs, you should consider seeing a doctor for proper evaluation. Another important sign is slower movement. A person may notice that daily activities take more time than before, such as getting up from a chair, walking, getting dressed, buttoning a shirt, or holding objects. At first, they may think they are just tired, not sleeping well, or simply getting older. But if this slower movement continues and begins to affect daily life, it should not be ignored. Muscle stiffness may appear in the arms, legs, shoulders, neck, or back. A person may feel that the body is heavy. It is harder to turn around. The arms do not swing naturally while walking, or the muscles feel sore more easily. This sign is often mistaken for common joint or muscle pain. But if stiffness lasts for a long time and appears together with a mild tremor, slower walking, or reduced arm swing while walking, you should pay more attention. One fairly characteristic sign that is often missed is handwriting that becomes smaller over time. A person may notice that their handwriting becomes smaller, more crowded, harder to read, or slower than before. At first, the handwriting may look normal, but the longer the person writes, the smaller and harder to control it becomes. If smaller handwriting appears together with a mild tremor, hand stiffness, or slower hand movements, it is worth monitoring and getting checked if needed. In the early stage, a person with Parkinson's disease may begin to walk differently. They may take shorter steps, drag one foot slightly, swing one arm less while walking, or feel that it is harder to start walking. Some people may turn more slowly, lean slightly forward, or feel less balanced than before. These changes often appear gradually, so the person may not notice them at first. Family members may be the first to see the difference. Some people with Parkinson's disease may experience a reduced sense of smell very early. They may have trouble smelling coffee, food, perfume, spices, or other familiar scents. Of course, a reduced sense of smell can also be caused by a cold, sinus problems, allergies, viral infections, or many other reasons. But if this problem lasts for a long time without a clear cause, especially when it appears together with a mild tremor, muscle stiffness, or changes in walking, it is worth paying more attention to. Sleep problems may also appear in some people during the early stage. Some people may have restless sleep, talk during sleep, move strongly while dreaming, swing their arms, or kick their legs during sleep. They may also have trouble falling asleep, wake up many times during the night, or feel tired during the day. Sleep problems do not automatically mean Parkinson's disease, but if they appear together with a mild tremor, muscle stiffness, slower movement, or changes in walking, they should be monitored more carefully. Another possible sign is a softer voice than before. A person may speak more quietly, have a flatter voice, pronounce words less clearly, or speak more slowly. Sometimes the person does not notice this change, but family members may feel that they are speaking more softly and are harder to hear. If this voice change lasts for a long time, especially when it appears with reduced facial expression or slower movement, it may be a sign to pay attention to. Some people with Parkinson's disease may have less facial expression. They may blink less, smile less, or look sad, tired, or serious even when they do not feel that way inside. This does not mean the person is cold or uninterested. It may be related to reduced flexibility of the facial muscles. Family members are often the first to notice this sign. Parkinson's disease does not only affect movement. Some non-movement symptoms may also appear early. A person may experience long-lasting constipation, unexplained fatigue, anxiety, low mood, or reduced interest in daily activities. These symptoms can have many different causes. However, if they appear together with a mild tremor, muscle stiffness, slower movement, smaller handwriting, or changes in walking, they should not be ignored. Another sign worth paying attention to is drooling or mild difficulty swallowing. Some people may notice that they drool more easily than before, especially while sleeping, sitting still for a long time, or talking less. This does not always mean the body is producing too much saliva. In some cases, it may be related to slower swallowing, less frequent swallowing, or reduced flexibility of the muscles around the mouth and throat. A person may also feel that swallowing food takes longer, that they need to swallow several times, that food feels stuck in the throat, or that they occasionally choke slightly while eating or drinking. This sign can have many other causes, such as dental problems, acid reflux, throat conditions, or medication side effects, but if it appears together with a softer voice, reduced facial expression, muscle stiffness, or slower movement, it is worth paying more attention to. Some people may experience frequent foot cramps, foot stiffness, or curled toes, especially on one side of the body. For example, the toes may curl inward, the foot may feel tight, or the arch of the foot may feel like it is pulling. Some people may feel that the foot is harder to place flat on the ground, making walking less natural and less comfortable. In some cases, this stiffness or cramping may appear when the person first gets out of bed. After sitting for a long time, or while walking, it may come and go at first. So many people may think it is only caused by tiredness, poor circulation, or normal muscle cramps. Foot cramps can happen for many reasons. They may be related to dehydration, low mineral levels, overuse of the muscles, spine problems, nerve problems, poor circulation, or certain medications. So, having foot cramps alone does not mean a person has Parkinson's disease. However, in some people with Parkinson's disease, foot stiffness or curled toes may be related to changes in muscle control and movement. It may appear together with slower movement, muscle stiffness, changes in walking, reduced arm swing, or a mild tremor on the same side of the body. This sign is worth paying attention to if it keeps coming back. Happens mostly on one side, affects walking, or appears together with other unusual changes. If foot stiffness, curled toes, or frequent cramps continue for a long time, it is a good idea to talk with a doctor or a neurologist for proper evaluation. Some people may feel dizzy, lightheaded, or slightly unsteady when standing up from a sitting or lying position. This may be related to changes in blood pressure when standing, but it can also occur with many other health conditions. If dizziness happens only occasionally, it may be related to poor sleep, dehydration, not eating enough, or certain medications. But if it happens frequently, increases the risk of falling, or appears together with tremors, muscle stiffness, slower movement, or changes in walking, you should discuss it with a doctor. For older adults, dizziness when standing up should not be ignored, because it may increase the risk of falls and injuries. Having one single sign does not mean you definitely have Parkinson's disease. For example, hand tremors can be caused by anxiety, too much caffeine, medication, or other health conditions. Constipation can be related to diet, not drinking enough water, or not moving enough. Sleep problems can also be caused by stress or many other health issues. So, you should not diagnose yourself at home. You should consider seeing a doctor if several signs last for a long time. Especially a tremor on one side of the body, slower movement, muscle stiffness, changes in walking, reduced balance, or symptoms that affect daily activities. A neurologist can evaluate your medical history, check your movement, walking pattern, balance, and related symptoms, then recommend the right next steps. To summarize, Parkinson's disease is a progressive neurological disorder related to a gradual decrease in dopamine-producing nerve cells in the brain. The exact cause is not fully understood, but age, genetics, environment, and gradual changes in the nervous system may all play a role. Early signs to watch for include a mild tremor at rest, slower movement, muscle stiffness, smaller handwriting, changes in walking, reduced sense of smell, sleep problems, a softer voice, reduced facial expression, constipation, fatigue, or mood changes. If you or someone you know has several of these signs for a long time, do not panic, but do not ignore them either. Seeing a doctor early may help identify the cause and guide proper care. If you found this video helpful, please hit the like button to support Mo Healthy. You can leave a comment below. What topic would you like Mo Healthy to cover next? How to care for someone with Parkinson's disease? Foods that may support brain health? Or gentle exercises to help maintain movement after 40? Don't forget to subscribe to Mo Healthy and turn on the notification bell so you won't miss new videos about health after 40. Common health concerns, and simple ways to build healthier daily habits. Thank you for being with Mo Healthy. Mo Healthy, understand your health. Build healthier habits today, and live better every day.